I am Lisa Obradovic and would like to welcome you to the podcast Certification Inspiration, produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as CWOCNCB. Founded in 1978, CWOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. In this episode, you will hear from two WOCNCB certified nurses, Gina Day and Lydia Beal, and how they are filling a gap for ostomy and wound care patients by establishing an online clinic offering telehealth visits. Telehealth has been brought to the forefront due to the devastating effects of the COVID-19 pandemic and the need to find alternative ways for patients to receive care. Patients have access to care without leaving their home. These virtual visits allow Gina and Lydia to provide specialized, cost-effective care, education, and timely communication with patients at a distance.
Hi, Gina.
Hi, Lydia.
Thank you, Lisa, for inviting us. We'd like to start out by giving a picture of our backgrounds and how we've been guided towards virtual care for our ostomy patients and the positive experience of a virtual appointment from the patient's perspective and the nurse's perspective. I am so happy to talk a little bit about a very special mentor, guide, ballast, and anchor in my life. Gina Day has been in the nursing field for over 25 years. Gina earned a bachelor's degree in nursing in 2009. She obtained her certifications in wound and ostomy care in 2012. Currently, she is enrolled in the Family Nurse Practitioner program at Moravian College. Gina has written articles about ostomy care and telehealth and has been published in The Phoenix, the Journal of Wound, Ostomy, and Continence Nursing, and Wound Management and Prevention. She just received the Star Volunteer of the Year Award from the UOAA. She also received the Friends of Nursing Award and the Florence Nightingale Exemplary Professional Practice Award for 2020 at her current employer. Gina has been running an ostomy support group since 2015, where there are over 20 active members who participate in supporting their other ostomates. She's developed races for Run for Resilience for Pennsylvania for the past 4 years. These events raise awareness about ostomy care. She has worked with Tina from Crohn's and Colitis Foundation on writing a blog titled Managing Ostomy Care in the Era of COVID-19. Lastly, Gina started an online ostomy clinic. Today's Ostomy Solutions, LLC, was established in August of 2019. Her aspirations for this clinic are to help ostomates live their lives with confidence. She has been working hard with other organizations to promote ostomy awareness and bring out the importance that no ostomate should feel alone.
Thank you so much, Lydia. It's my pleasure to introduce my supporter and my soul sister in this journey. Lydia Beal earned her Bachelor of Nursing and became a registered nurse in 2012. She is a certified wound, ostomy, and continence nurse since 2016 and joined today's Ostomy Solutions from the beginning stages. Lydia lives and farms in Royal Washington County, Maine, and works from home. She's continuing her education, building knowledge, and working towards obtaining her certification and billing and coding through the AAPC's course programs. Lydia is the brand new chairperson for the New England Region WOC Nursing Society Public and Policy and Advocacy Committee. Congratulations, Lydia.
Thank you, Gina.
Lydia is affiliated with the UOAA support group in Maine. She has worked for community home care agencies providing effective care and educating for patients with wounds and ostomies. Lydia also volunteered with a nonprofit organization providing incontinence supplies for underserved communities.
Thank you, Gina. Gina, let's talk about how your career as a WON led you in the path of virtual ostomy and wound care.
Absolutely. I would like to start out with discussing how, being a certified wound ostomy nurse and why it's important to become certified. The Wound Ostomy Continence Nurse Certification Board, CWOCN, they provide a gold standard for certification. Becoming a board-certified wound ostomy continence nurse transfers specialized skills and experience to provide expert care. Being board-certified ensures that the nurse is knowledgeable and well qualified to provide proficient care to patients for wound ostomy and continence needs. With being a certified wound ostomy nurse, these expert qualifications gave me the credibility and the confidence to open an online wound ostomy clinic. It is important to me to hold high standards of care, with the WOCNCB has expressed as a very, very valuable with providing consultation. I've always had an interest in owning my own business as a certified wound ostomy nurse in different settings. And through my journey with expertise, I recognized the gap in care and wanted to develop a plan for helping to bridge those gaps. With technology providing us the connection virtually, an online telehealth clinic just made sense to me.
Absolutely, Gina. And I wanted to explain to the listeners here that we ask our patients if they would please fill out an appointment evaluation after our appointment with them. And here we can see directly some of the benefits that they experience. So from Anthony, he says, Gina really puts me at ease. She was extremely knowledgeable and friendly.
Yes, Anthony, when he first came on, he was concerned and he had, some apprehensiveness with showing me his stoma, with body image concerns. So I was really happy when he responded this way and acknowledged that he was able to, show me his stoma. I let him know it's okay and that, we'll get through this together.
That was wonderful. Yes. For Mariana, she says, I learned how to measure my stoma and cut the appliance to the right size, and I learned that I can do things to help keep my skin from being irritated.
Yeah, so many patients that have had their stoma for a while, even our new patients, they like using a lot of products on their skin. I have seen tape all over their appliance because they want to make sure that their appliance is going to hold up. I have to go back and explain to them that they have to have confidence in their product. And I think that from hearing that from a certified ostomy nurse, goes a long way. One of my mantras when I do my education for anybody who has an ostomy, it doesn't matter if they're long term or if they are a new ostomate. I always tell them to go back to the basics and start out from the beginning and not putting so much products on their skin, because more product they have on their skin, it actually makes things worse. And when we do go back that direction, a lot of patients were like, wow, that really did help.
Yeah, that's so important. And I think that when you're able to provide those tips and little bits of education for patients, it's so helpful, because these things aren't naturally intuitive. I think it's so important that we just kind of keep learning and keep teaching. So from Tanya, she says, the time was spent fully and thoroughly, and the care plan gave us a step-by-step explanation of care and solutions to my problems.
Well, Lydia, I'm going to have to give you kudos to this one. Lydia comes on to our visits, and she will write down the step-by-step instructions that are given out to these patients as I'm instructing the patients on what to do and what products that we might need and what appliances that we might change to. Lydia allows that patient to be able to focus on what I'm educating them on and not worried about every single little step that the patient's going to need to do after our visit. So having a care plan with the step-by-step instructions gives that patient confidence that they can just relax and obtain the information that we are giving them. Our goal is to gain trust with this patient, and we have to do it in a really short period of time. So, allowing them to just engage with us and saying, you know what, you don't need to listen to every single thing, and you don't have to pick up every single thing that we're telling you, because we will be writing this step-by-step instructions. It gives that patient and lets them to be a little bit more at ease and not so anxious with, what to expect during this visit.
Mm-hmm. Absolutely. Thanks, Gina. From Diane, coming on to www.ostomynow.org was very convenient. Scheduling an appointment and having a great selection of time that worked for me was very important to my schedule. I am confident that if I have another issue, I have someone I can go to for immediate help. I'm relieved also because I had a solution to my issue, and it actually worked. Being able to schedule a visit at night allowed me not to miss work and be in the comfort of my own home. I didn't have to wait in a waiting room or wait 6 weeks for an appointment. I will schedule another visit with today's Ostomy Solutions for follow-up care.
Yeah, so with Diane, we wanted to make sure this really validates our availability and accessibility, that patients can come onto our service at any time. We do weekends, we can do holidays, and patients can request those dates and times. And we do, have our schedule up on the website so that they can find out what works best for them. This gives them, again, the support that they need and helping them get independent with their care.
Mm-hmm. So true. We really want to be flexible along with our patients. And here's from Phil. He says, "You will never be alone, and Gina sees to it that people are not. Gina fills the void and disconnects that some patients feel after they leave the hospital."
That just tells you how important it is to fill those gaps and to know that each step of the way that there is somebody to be able to support them. And that's one of the biggest reasons why I did open that support group, is to make sure that nobody feels that they're left, alone. And, we want to make sure that every single patient feels this.
Absolutely. It's their right, it's the patient's right to always have support when they need it. Here is from Dr. Covington. He says, "I know ostomy patients are dealing with life changes. I think ostomy patients would benefit from telehealth for a couple of reasons: lack of transportation, living in rural areas, accessibility is poor, and no resources once discharged from the hospital, not having adequate education during their course as an ostomate from the preoperative period to the postoperative period. And the ostomates having access to an ostomy nurse is essential throughout this whole journey."
Yes, Dr. Covington is a GI doctor in Pennsylvania. He refers a lot of his patients to me, and he sees the value in using telehealth care because he understands that not every hospital has an ostomy nurse. And when a patient doesn't have an access to an ostomy nurse, he sees that these patients don't do as well and have a good, strong foundation to their care as to the patients who do have an ostomy nurse. So he refers a lot of his patients to today's Ostomy Solutions to help these patients, get a stronger foundation, get the direct care that they need, and to fill any voids that these patients might be experiencing, and just to know that there is support that they can get with easy access.
Yeah, it's excellent. I think it's critical for WOC nurses to have that good relationship and connections with physicians and surgeons.
Absolutely. So some of the benefits that, we see as nurses, and as my experience with today's Ostomy Solutions, our goal is really truly to be providing security and safety to each visit that these patients come into. So the portal that we use for today's Ostomy Solutions is HIPAA compliant. It does have a secured website so that when these patients come on and they're expressing their concerns and talking about their stoma, it's just between us two, that they know that is available to them. The other thing is giving them confidence and support during the visit, allowing them to be able to talk about their stoma, allowing them to talk about their experience, letting them talk about their concerns. Or, I have a lot of patients who want to get their family involved and not really sure how to communicate with them, or they want to go swimming. They want to be intimate with their loved one. And, we do help support and educate them on different aspects of living with an ostomy. It's not just about their stoma. It's about actually living with their ostomy for the rest of their lives. Or even if it's temporary, they still have those type of questions that we can support that. Allowing them not to feel rushed and giving them time to ask questions and getting the true answers, and being that we're doing this one-to-one, that they don't have to worry about, I'm in a rush, I got to go. We don't have a time frame that if this patient needs a little bit more time, we can give it. They're not in a doctor's office where you get 15 minutes and you have to rush out the door. This one-to-one care that we're giving through telehealth allows us to be able to not dictate and say, okay, you know what, we can give them a little bit more time if needed. We can give them item numbers, product numbers, giving them some samples, educating them about the different product companies that are out there that are available. A lot of my ostomists didn't even know that there were other companies out there. So we can give them that information and letting them know that it's not one all end all, that there are multiple companies out there, and that every one of them have different types of products that we can try. The other things that we encourage them to express their concerns, and we make sure that we address those concerns at each visit.
Gina, thank you for explaining that. That was really, really good. And also, thank you for talking with me together, talking with each other tonight about this option for ostomy patients and their families. And thank you again, WOCNCB, for having us on your podcast. Stay in touch, everyone, and follow today's Ostomy Solutions on Facebook, Twitter, LinkedIn, or just visit us at the website www.ostomynow.org.
And I want to thank Lisa and thank you, Lydia, for helping me with this option and talking about telehealth, and hopefully that, this will touch many people's lives and, we can make a difference.
Thank you, Gina. Have a good night.
Have a good night.
Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more, or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.